Okay, this is Drusilla Williams. I'm going to talk about Hemovac and JP drains. This is a JP, Jackson Pratt. Looks like a hand grenade. It's referred to as a hand grenade. Okay, and so I have a small cup that says JP on it. These are Hemovacs. They're different styles. This is a Hemovac canister for collection. This is another type of Hemovac. They have wiry compression devices in there to keep them compressed down. And this one also is a Hemovac. This one here is for auto transfusion. If someone wants their own blood given back and they've had a major joint repair, they can hook this up, and it tells you do not open on some of these. That they will collect the blood, turn it over. There's a filter inside, and they will re-infuse this in the patient. Has to be within the first 4 hours, as in collect and re-infuse. Less than 4 hours. Otherwise, treat it like a drain. They will date and time these if you can use the blood or not. So you'll see these types. We're going to check off on these two, the JP and the Hemovac. Okay? First thing, it says review physician orders for drain and site care. We don't have to have an order to empty the drain, but if you're going to do a dressing change on the JP and Hemovac, you need to have a doctor's orders. Number 1, check doctor's orders. 2, get your supply, get your canister. Number 3, identify your patient. I don't have a patient hooked up here, but you're seeing the drains. Perform hand hygiene. Put on some gloves. Exam gloves are fine. This is not a sterile procedure. It's a clean procedure. Put on your gloves. Close the door for privacy. If you have a patient, drape your patient so all you have to see is just the area that you're doing. This is hooked up to a patient. You keep this exposed. This is hooked up to a patient. You keep your patient covered up. Well, get this out of the way. These are hooked up to patients. I'm going to hold it in my hand right there for right now. But they're hooked up. You make sure you lay a waterproof pad down. See this waterproof pad? Okay. A Chuck's, a waterproof pad. If you don't have that, a towel. A towel. T-O-W-E-L. I'm from Arkansas. Towel. To make sure that you save your bed linen. You don't want to have blood all over the sheets if you happen to make a mess. Then you get your graduated picture. You have this hooked up to your patient. I'm going to just drape this underneath there so you know it's hooked to a patient. You have your Jackson Pratt, which is not going to cooperate with that. So just know, don't pull too far or you will pull it out of the patient. Make sure you know where the tether's at. Don't pull too far. Okay? I want to have it, my canister, close to the patient and close to my JP, Jackson Pratt. I need to get an alcohol pad. Alcohol pad. Okay? I need to open it and keep it available. It's easy to get. Okay, you open, there's a little top you pop off and open it toward your structure. Actually, you want to open it in a way it will not splash on you or the patient. Then you squeeze and pour your solution into the container. You get it all emptied. Whoops, there goes my alcohol pad. Give me another one. Things happen on video. You're going to clean this port off before you close it. You get you an alcohol pad. You compress your Jackson Pratt or your hand grenade. Clean it off. Clean this off, the little male and female part. That goes together. Compress in. And put your seal on there. Now, on your patient, if it's hooked into a patient, when I let go, it would slowly... The compression causes the suction. When I open this, it should stay, and it won't because it's in the patient is my hand, but it would stay compressed. So if I did this properly in the hospital, it would stay compressed and it would pull back the fluid on the patient. Remember coca? Forget the alcohol pad in there. Coca. What is the color of the drainage? What is the odor? Does it smell? The consistency. Is it sanguinous, or serous? Does it have clots in it? So the COCA, color, odor, consistency, and the amount. How much is in this Jackson Pratt? So was it 60, 30, 90? And you would document this in your I&O, your intake and output. And you'd secure this Jackson Pratt back to the patient. There's a clippy. You can clip this onto their gown. And you have this compressed, and then you go off and come back. You usually have to empty a Jackson Pratt about every 1 to 2 hours when you first put it in. After that, it's how fast it fills up, it's how fast you empty it. Okay, that's your Jackson Pratt. And you document your COCA of your drainage and where the Jackson Pratt was, and the condition of the, if it had a dressing, the condition of the dressing where the Jackson Pratt or the Hemovac at. Okay, refer to Taylor's 8.9. I'm going to set this over to the side. Now we're going to talk about the Hemovac. Look at 8.10. The difference is you still got to have the orders, gather your supplies, a waterproof pad, alcohol, the container, and identify your patient. Put on exam gloves. After your hand hygiene, close the curtain, drape them. Put your graduated picture right there. This is hooked to the patient. This here is into the patient, so you make sure you pull it out in a way it will not pull out of the patient. Don't pull this loose from the patient. Okay? Lay this there. It's like it's under the patient. You get your Hemovac. You pop it loose. Let's get your alcohol. Try again here. See if I don't drop it again, y'all. Get your Hemovac ready. Open your container gently. Jeez. There we go. Okay. And you make sure that you pour it into your cup like this. And it will go in the canister. And you compress it down. See that there's a wire in there that presses it down. You may have to set it down on the bed, compress it down, clean your male and female part of your Hemovac. That's the only way I can describe it. Male and female part. Clean it, get the blood off of it, compress it down, and close it. Close it. It should stay compressed. As it suctions, it will open up and expand, and it will collect. You would actually check for any kinks on your tubing on either one of these. You would document COCA. What's the color, odor, consistency, and amount of your Hemovac? And you document that on your INO and your nurse's notes and describe serous sanguinous, serous, and serous sanguinous, serous, and serum. Sorry. Okay. But make sure that you know the COCA, color, odor, consistency, and amount. And said make sure you can also hook this on the patient's gown. So serous, serous sanguinous. Yeah, it's serous, serous sanguinous, and sanguinous. There we go. My camera girl is helping me. Thank you. Serous, serous sanguinous, and sanguinous. Look in Taylor's how to describe them. You need to describe them to your instructor. This is how you empty a Hemovac or a JP drain.